Hi, my name is Ali Jazieri. I'm a fellow at the University of Kansas, and I'm here today with Dr. Robert Califf, who's a professor of medicine at the Duke Clinical Research Institute, on behalf of the FITSontheGo blog. Dr. Califf, thanks for joining us.
You bet. It's great to be here with you.
So Dr. Califf is going to be discussing the topic of health equity here at American College of Cardiology scientific sessions, and so we'd like to get his input on how do you define health equity.
Well, speaking of equity, I notice you're from Kansas and I'm from Duke, and this is a certain time of year where it's equitable for us to even be in the same place together and smiling at each other.
Indeed.
So that's one definition. But on a serious note, health equity really would be defined as equal opportunity for good outcomes for all people, regardless of their individual personal characteristics.
Very good. And in terms of health equity in the United States, what do you see as being sort of the biggest barriers to health equity?
Maybe it's good to start out with just what the observations are. And there's a really critical paper by Chris Murray and his group out in Seattle that talks about the 8 Americas. And it's kind of the easiest way to think about it. Just defined by race and sex, you end up with 8 very distinct groups of people in America with very different outcomes. Or another way to look at it, we're here in Washington, D.C. If you're born next to the Union Station, metro station, your life expectancy is 12 years shorter than if you're born out and live out in Chevy Chase, which is where my apartment currently is. And so we have very different outcomes in the U.S. depending on who you are and where you live. And so then we get to the question of what to do about it. Now, I'm preparing for a lecture tomorrow, and it's such an unstable time right now, trying to decide what to really say. But I think a good place to start is by examining the question among ourselves, is health equity a goal? Is it something that we really want to achieve? That may sound like, how can anyone not be in favor of health equity? Well, the answer is, if you look at policies and the way they're implemented, they have a fairly predictable result on the dispersion of health outcomes in our society.
Very interesting. What do you think from the standpoint of cardiologists, what their involvement is with regards to trying to promote health equity?
Well, so here I think we sort of have to look at it from maybe 3 time frames. In the long run, the real issue is we know that most health outcomes are determined much more by social determinants than by biological determinants. So education, jobs, reasonable amounts of money for people so they can function, and social mobility as goals of society. That's very long term. We're not going to affect that in a short period of time. But as I say, there are predictable consequences of decisions that we make now on the generation of people who are currently growing up. In the middle time frame, we know that there are things we can do within our own health systems to advocate for policies and approaches that lead to more equitable access and outcomes. And in the short term, just being aware of our own biases, which are mostly, I think it's now pretty clear, among highly professional groups like cardiologists, most of the biases that lead to different outcomes at an individual level are subconscious. They're not things that we think about. And there's some great studies, including just last month, showing that the way the person across from you looks has a big impact on the way you sort of make decisions about how you're going to approach them and deal with them. But let's go back to the middle part. What about in our own health systems? And access to healthcare is really in play right now on a big scale.
Absolutely.
In the U.S. Major decisions are being made by the attempted repeal of the Accountable Care Act. And I think cardiologists need to be involved because it seems likely that just pure repeal is not going to work. It's going to be a fairly drawn out harangue among legislators about what to do. And I think we owe it to our patients to be involved in trying to make sure that people at least have access to the great services that cardiologists can provide.
Thank you so much for your time, Dr. Califf.